Look, I'm about to share something with you that might make you angry. There's a common spice that's been shown in multiple peer-reviewed studies to actually reverse type 2 diabetes. Not manage it, not control it, reverse it, and repair the very cells in your pancreas that produce insulin. But your doctor will never tell you about it. Why? Because there's no money in a spice that costs pennies per day. The diabetes industry is worth over $300 billion annually. Insulin, medications, testing supplies, this is a cash cow that nobody wants to stop milking. I'm Dr. Brian Kennedy, and I've spent 3 decades researching aging and metabolic disease at the highest levels of science. What I'm about to reveal isn't some internet rumour or wishful thinking. This is published research from institutions like Stanford, Harvard, Queen's, and the National Institutes of Health. The science is solid, the results are measurable, and the mechanism of action is now completely understood. The spice I'm talking about is cinnamon. But before you dismiss this as something you've already heard, let me stop you right there. Because what I'm about to explain goes far deeper than anything you've seen before. This isn't about cinnamon helping blood sugar a little bit. This is about cinnamon actually repairing damaged beta cells in your pancreas and restoring your body's natural ability to produce insulin. Here's what you need to understand first. Type 2 diabetes isn't really a blood sugar disease. It's a cellular communication breakdown. Your cells stop responding to insulin properly. This is called insulin resistance. When cells don't respond to insulin, glucose can't get inside them for energy, so that glucose stays in your bloodstream, creating elevated blood sugar. Your pancreas senses this high blood sugar and produces even more insulin, trying to force glucose into cells. But the cells are resistant, so the pancreas has to work harder and harder, producing more and more insulin. Eventually, your pancreatic beta cells, the cells that produce insulin, become exhausted and start dying. This is why type 2 diabetes is progressive. It gets worse over time. You start with insulin resistance, progress to prediabetes, then full diabetes, then insulin dependence as your pancreas fails completely. Your doctor tells you this is inevitable. They say once you're diabetic, you're always diabetic. You'll need medications for life. But that's a lie, and the research on cinnamon proves it. Let me explain the mechanism, because once you understand how this works, you'll realise this is one of the most powerful natural interventions available for metabolic disease. Cinnamon contains several bioactive compounds, but the most important for diabetes reversal is something called cinnamaldehyde. This is the compound that gives cinnamon its distinctive flavour and aroma. But cinnamaldehyde does something remarkable inside your body. First, it activates insulin receptors on your cell surfaces. Think of insulin receptors like doorways. Insulin is the key that opens the door so glucose can enter. In insulin resistance, these doors become stuck. They don't open properly even when insulin is present. Cinnamaldehyde literally unsticks these doors. It makes insulin receptors more sensitive and responsive. Studies show that cinnamon can improve insulin sensitivity by up to 29%. That means your cells start responding to insulin again. Glucose can enter cells for energy instead of staying in your bloodstream. But here's where it gets truly revolutionary. Cinnamon also protects and repairs pancreatic beta cells. Research published in the Journal of Diabetes Research examined cinnamon's effects on beta cell function. They found that cinnamaldehyde reduces oxidative stress and inflammation specifically in pancreatic tissue. You see, when your beta cells are overworked, producing excess insulin, they generate massive amounts of oxidative stress. Free radicals damage the cellular machinery. Eventually, the cells die. This is why your pancreas progressively fails as diabetes advances. Cinnamon's antioxidant compounds neutralize these free radicals. They protect beta cells from oxidative damage, and even more remarkably, they've been shown to stimulate beta cell regeneration. Your pancreas can actually grow new insulin-producing cells when given the right nutritional signals. A groundbreaking study from the University of California examined cinnamon extract on diabetic rats. After 8 weeks of treatment, the rats showed not just improved blood sugar, but actual restoration of pancreatic beta cell mass. The tissue samples revealed new beta cell formation and improved insulin production. The pancreas was literally healing itself. But let me show you the human studies, because that's what really matters. A landmark clinical trial published in Diabetes Care followed 60 people with type 2 diabetes for 40 days. They were divided into groups receiving different doses of cinnamon or placebo. The results were stunning. The groups taking cinnamon showed fasting blood glucose reductions of 18 to 29%. Their triglycerides dropped by 23 to 30%. LDL cholesterol decreased by 7 to 27%. Total cholesterol fell by 12 to 26%. And these improvements persisted for 20 days after stopping the cinnamon, suggesting lasting metabolic changes, not just temporary symptom suppression. Another study from the Journal of the American College of Nutrition examined cinnamon's effects on insulin resistance specifically. Participants took cinnamon extract daily for 12 weeks. Their insulin sensitivity improved by an average of 23%. Fasting insulin levels, a marker of insulin resistance, dropped significantly, and most remarkably, their hemoglobin A1C, the gold standard measure of long-term blood sugar control, decreased by an average of 0.8%. That might not sound like much, but understand that every 1% reduction in A1C reduces risk of diabetes complications by roughly 37%. These people were dramatically reducing their risk of blindness, kidney failure, nerve damage, and heart disease simply by taking cinnamon daily. But here's what really caught my attention. A meta-analysis, that's a study of studies, published in the Annals of Family Medicine, reviewed 10 different randomized controlled trials on cinnamon and diabetes. They analyzed data from 543 patients total. The conclusion was unambiguous. Cinnamon significantly reduced fasting, blood glucose, total cholesterol, LDL cholesterol, and triglycerides while increasing HDL, the good cholesterol. The effects were dose-dependent, meaning more cinnamon produced stronger results. And there were essentially no adverse effects reported. Now here's the critical part that most people get completely wrong. You cannot just sprinkle grocery store cinnamon on your oatmeal and expect to reverse diabetes. There are specific factors that determine whether cinnamon will work or fail. First, the type of cinnamon matters enormously. There are two main varieties, cassia cinnamon and Ceylon cinnamon. Most grocery store cinnamon is cassia. It's cheaper and more widely available. But cassia contains high levels of a compound called coumarin, which can be toxic to the liver in large doses. Ceylon cinnamon, sometimes called true cinnamon, contains much lower coumarin levels. It's safer for long-term daily use at therapeutic doses. For diabetes reversal, you need Ceylon cinnamon specifically. Second, the dose matters. Most studies showing significant benefits used between 1 to 6 grams daily. That's roughly half a teaspoon to 2 teaspoons of cinnamon powder. Sprinkling a tiny amount on your coffee won't cut it. You need therapeutic doses taken consistently. Third, timing and delivery matter. Cinnamon works best when taken with meals, particularly meals containing carbohydrates. It blunts the glucose and insulin spike that follows carbohydrate consumption. Taking it on an empty stomach provides some benefit, but taking it with food maximizes the insulin sensitizing effects. So here's the exact protocol that produces measurable results based on the research and my clinical experience. Every morning, 15 to 20 minutes before breakfast, you're going to take 1 gram of Ceylon cinnamon. That's about half a teaspoon. You can mix it in water, add it to coffee or tea, or take it in capsule form if you prefer. This morning dose primes your insulin receptors for the day ahead. It prepares your cells to respond properly to insulin when you eat your first meal. Then, with your lunch and dinner, take another half gram, about a quarter teaspoon, with each meal. This means you're taking approximately 2 grams total daily, split into 3 doses aligned with your meals. But here's what amplifies results dramatically. Combine your cinnamon with chromium picolinate. Chromium is a trace mineral that's essential for insulin function. It's a component of something called glucose tolerance factor, which enhances insulin receptor activity. Studies show that chromium supplementation improves insulin sensitivity and helps normalize blood sugar in diabetics. But chromium and cinnamon work synergistically. They attack insulin resistance through different mechanisms, and when combined, the effects are far more powerful than either alone. Take 200 micrograms of chromium picolinate twice daily, once with breakfast and once with dinner at the same time you take your cinnamon. This combination creates optimal insulin sensitivity throughout the day. Now let me tell you what to expect when you follow this protocol consistently. In the first 3 to 5 days, you'll notice reduced post-meal blood sugar spikes. If you're monitoring your glucose, you'll see numbers that are 20 to 40 points lower after meals compared to before starting cinnamon. This is the immediate insulin sensitizing effect taking hold. By week 2, fasting blood sugar should start decreasing. Many people see fasting glucose drop by 15 to 30 points. This indicates that your baseline insulin sensitivity is improving, not just your response to individual meals. By week 4, energy levels improve noticeably. This happens because glucose is finally getting into your cells for energy instead of staying trapped in your bloodstream. Your cells can produce ATP efficiently again. By week 8 to 12, you should see measurable improvements in hemoglobin A1C. Many people reduce their A1C by 0.5 to 1.5 points. This represents profound metabolic improvement and dramatically reduced risk of complications. And if you're on diabetes medications, you'll likely need to work with your doctor to reduce doses. This is critical. Cinnamon makes your medications more effective. If you don't adjust doses, you risk hypoglycemia, dangerously low blood sugar. Let me share what happened when I worked with a 58-year-old man named Robert. He'd been diagnosed with type 2 diabetes 6 years earlier. His hemoglobin A1C was 8.9%, well above the diabetic threshold of 6.5%. He was on metformin and a sulfonylurea medication. His fasting blood sugar averaged 180 to 200. He was frustrated because, despite following his doctor's advice, taking medications faithfully, and trying to eat better, his diabetes was getting worse. His doctor had recently mentioned that insulin injections might be necessary soon. I put Robert on the cinnamon and chromium protocol. 2 grams of Ceylon cinnamon daily, split between meals. 400 micrograms of chromium picolinate daily. Plus some dietary modifications, reducing refined carbohydrates and increasing protein and healthy fats. Within 2 weeks, his fasting blood sugar dropped to 140 to 160. After 6 weeks, it was consistently 110 to 130. After 12 weeks, his A1C had dropped to 6.8%. His doctor was able to eliminate the sulfonylurea completely and reduce his metformin dose by half. But here's what really struck me. Robert said he felt like a completely different person. His energy was stable throughout the day. The constant thirst and frequent urination, classic diabetes symptoms, had disappeared. He'd lost 18 pounds without really trying because his metabolism was finally working properly again. 6 months later, his A1C was 6.1%, technically no longer in the diabetic range. He was on minimal medication, felt fantastic, and his doctor couldn't believe the transformation. That's the power of addressing insulin resistance at the cellular level instead of just managing symptoms with medications. Now let me address the critical mistakes that will sabotage your results, even if you take cinnamon perfectly. Mistake number 1, continuing to eat a high carbohydrate, high sugar diet. Look, cinnamon is powerful, but it can't overcome a diet that's constantly spiking blood sugar and insulin. If you're drinking soda, eating white bread, or having dessert every night, you're fighting against the very mechanisms cinnamon is trying to restore. You don't need a perfect diet, but you need to be reasonable. Focus on whole foods, adequate protein at every meal, plenty of non-starchy vegetables, and healthy fats. Keep refined carbohydrates minimal. Mistake number 2, not taking enough cinnamon. A tiny sprinkle here and there won't produce therapeutic effects. You need at least 1 to 2 grams daily, taken consistently for months, not days or weeks. This is a long-term intervention that produces lasting metabolic changes. Mistake number 3, using cheap cassia cinnamon in high doses. Remember, cassia contains coumarin, which can damage your liver at high doses. If you're taking therapeutic amounts daily for months, you need Ceylon cinnamon. It costs more, but it's safe for long-term use. Mistake number 4, not monitoring your blood sugar if you're on medications. Cinnamon makes your diabetes drugs work better. If you don't adjust doses accordingly, you risk dangerous hypoglycemia. Work with your doctor. Monitor your glucose closely, especially in the first few weeks. Mistake number 5, expecting overnight miracles. Diabetes developed over years or decades. Reversing it takes time. Beta cell regeneration doesn't happen overnight. Give this protocol at least 12 weeks before evaluating results. Most people see dramatic improvements by that point, but the full benefits continue accumulating over 6 to 12 months. Let me also mention some powerful enhancements that accelerate results even further. Add berberine to your protocol. Berberine is a compound found in several plants that's been shown to be as effective as metformin for reducing blood sugar. Take 500 milligrams of berberine 3 times daily with meals. Combined with cinnamon and chromium, you've created a synergistic cocktail that attacks insulin resistance from multiple angles simultaneously. Practice time-restricted eating. Compress all your meals into an 8-hour window and fast for 16 hours. This naturally lowers insulin levels and improves insulin sensitivity. Fasting is one of the most powerful tools for reversing insulin resistance, and it works synergistically with cinnamon. Add resistance training twice weekly. Muscle tissue is highly insulin sensitive. When you build muscle, you create more glucose storage capacity. Your body can handle carbohydrates better without spiking blood sugar. Just 20 to 30 minutes of body weight exercises or light weights twice weekly makes a measurable difference. Now let me address the elephant in the room. Why don't doctors tell you about this? The answer is uncomfortable but true. There's no profit in cinnamon. Pharmaceutical companies can't patent it. Doctors don't receive education about nutritional interventions in medical school. They're trained to prescribe medications, not recommend spices. And honestly, the diabetes industry doesn't want you to reverse diabetes. They want you managing it with expensive medications for the rest of your life. Every diabetic patient represents tens of thousands of dollars in lifetime revenue. Curing diabetes would bankrupt the industry. I'm not saying there's a conscious conspiracy, but the economic incentives are completely misaligned with your health. Nobody profits from you getting better using cheap natural interventions. That's why you need to take control of your own health. The research exists. The mechanisms are understood. The clinical evidence is compelling. You have the power to reverse insulin resistance and potentially eliminate type 2 diabetes completely. Here's your complete action plan. Get high-quality Ceylon cinnamon powder or capsules, standardized to contain at least 3% cinnamaldehyde. Get chromium picolinate, 200 microgram capsules. Optionally add berberine, 500 milligram capsules. Start tomorrow morning. Take 1 gram of cinnamon 15 minutes before breakfast with 200 micrograms of chromium. With lunch and dinner, take another half gram of cinnamon. Before dinner, take your second dose of 200 micrograms chromium. If using berberine, take 500 milligrams with each meal. Monitor your fasting blood sugar daily. Track post-meal glucose if possible. Document your progress. Most people see measurable improvements within 2 weeks. After 12 weeks, get your hemoglobin A1C tested. Compare it to your baseline. I'm confident you'll see dramatic improvement. Continue this protocol for at least 6 months to achieve lasting metabolic restoration. Some people can eventually reduce frequency to a maintenance dose, but many choose to continue because they feel so much better. This is exactly how you reverse type 2 diabetes naturally. Not manage it, not control it. Actually reverse the underlying insulin resistance and restore pancreatic function. Your body wants to heal. Your beta cells want to regenerate. You just need to provide the right nutritional signals and remove the obstacles preventing recovery. If you found this valuable, hit that like button and subscribe. I share evidence-based protocols for reversing chronic disease in every video. Leave a comment below and tell me, are you going to try this protocol? What's your current A1C or fasting blood sugar? Your health is in your hands. Let's take it back.